Good afternoon and welcome to this week's Facebook Live. I'm Dan Bevels with Floyd's Public Relations Department, and we're glad to be with you again this afternoon to talk about Floyd's response to the COVID-19 pandemic. We've been doing these over the last several weeks as a way to provide you with updated information about the things that we're doing here at Floyd to respond, be it visitor policy or PPE usage or any number of things. We've tried to be as open and as transparent as possible over the last several weeks, and we're going to continue that today with the discussion that we're going to have in just a few minutes. I want to tell you that this will be the last of these Facebook Live editions that we're going to do for a while anyway, barring some kind of change. As we've said throughout this process, this is a very fluid situation, and we realize that it could ramp up at any time, and if need be, we can come back and do these pretty immediately. But for the time being, as long as things stay as they are right now, this will be the last one we do, at least for the foreseeable future. But we do want to say, I would be remiss if I didn't say it, and so I want to say now, thank you for joining us each week and allowing us to provide these updates for you. I want to welcome back in, as we have at almost every one of these, Kurt Stunkel, our President and Chief Executive Officer, for an update on where we are today. Kurt, it's hard to believe. I think I haven't counted, but I think we're 8 or so weeks into doing these, it seems like, and I want to say thanks to you for being so open about what's going on here at Floyd and providing this venue.
Well, you mentioned a second ago, Dan, about transparency, and that's always our desire, to be transparent. Just about everything at Floyd is transparent. There are a few things that are confidential, like patient information, your individual patient information, my individual patient information, our relatives, all that's confidential. Certain of our quality measurements are confidential, our business plans, but just about anything else, it's an open book at Floyd. I mean, we're a public hospital, we're not for profit, and we adhere to open records, open meetings. We're very transparent in everything that we do. And one of the reasons that we decided to do these Facebook Live sessions was to clear up misconceptions, because we want to be clear in our communication, and we want people to understand as much as we can.
Well, we're going to do that in just a few minutes. I want to address some of the things that we see on social media from time to time. And as part of that process, we want to welcome you to submit your questions as well. You can do that in the comments section today. We may not get to all of them, and we're going to try to get to a few of those anyway before we wrap up in the next 15 minutes or so. So if you have a question that you would like to ask about our response, you can add that in the comments section. But Kurt, before we get to that point, I think we're encouraged about where things are at the moment. Numbers are remaining in the low single digits, and we're hoping that that's a good sign.
Well, in our neck of the woods, they are.
Right.
I mean, our numbers are down, but there are hot spots in other places. But, you know, I wore my mask into here, and I see your mask is over there too. We all need to do that. We all need to practice all of the things that we're supposed to, masking ourselves in public. In fact, here at Floyd, we encourage everybody. In fact, it's one of our standards of behavior is that we wear masks when we're walking the hallways, we wear masks to and from our vehicles, and of course, hand washing, using the hand sanitizer, not touching your face. I mean, all of these very sensible things in today's environment are things that we've got to practice.
And I think it's a situation where we obviously use the data, we trust the scientists and the physicians, but there's still a lot that's unknown about this, and so I think it's important to continue to follow those guidelines.
Oh, absolutely. And we've got to give credit to our city and county leaders here in Floyd County. Early on, even before the governor made the proclamations throughout Georgia, in our community in Floyd County, there was encouragement for businesses to shut down so that we could do all the appropriate social distancing. They actually solicited input from the hospitals and the physicians at the Harbin Clinic and other medical leaders, and they listened to us. And I think we're seeing the fruits of that very wise decision. And the counties around us as well did that. And our trends right now are, as you mentioned, going down, and we're glad they are. State of Georgia, they're going down as we track those. But as I mentioned a minute ago, there are some hot spots still. There's a hot spot in southwest Georgia, down in Dougherty County, where Albany is. There's still a lot of coronavirus down there. Also in Hall County and in Habersham County in Gainesville, Georgia. They're in the Latino, the Hispanic community. And some have speculated that it might be in poultry processing plants, although they haven't really targeted one as the genesis or the cause of it. It may be a cultural thing too, as people in the Hispanic community sometimes live a lot of people per household, and culturally they do a lot of things together. Who knows? But there is a hot spot in that area as well. So it can happen at any time. I think it was Dr. Fauci who said, and also our own Dr. Gary Voscio has said too here in Northwest Georgia, the coronavirus is still out there. It's still out there and circulating. And we've got to do the things that are necessary in order to protect ourselves and our fellow community members and our loved ones. And if we do that, I think the numbers could continue to stay down. Now, having said that, there are those in the nation who are predicting, experts, national experts, that there could be a second and perhaps a third wave of coronavirus as things get loosened all throughout the nation, state by state, community by community. Things could climb. I just looked at some statistics in preparation for this gathering today, and as they have counted them worldwide, and I think there are a lot of places that haven't accurately counted, like a lot of people are questioning China's accounting for the coronavirus, COVID-19, but there's about 500,000 deaths worldwide. In the United States, we've already crossed the 90,000 death threshold. In the state of Georgia, as of today, there's 1,675, and then in Floyd County, there's 13. Here at Floyd Medical Center, we have processed 352 patients as positive, that is, getting a positive result on a test. Now, that doesn't mean here at the hospital. In fact, most of those were in our urgent care centers. But here at the hospital, we've treated 84 inpatients as of today. And some might say, well, those are low numbers. Well, they are. Knock on wood, they stay that way. But when we looked at this way back in March, as you mentioned earlier, we've been at this for a long time, the numbers didn't look good then. And because of the way the numbers were looking at that point, we did some things here at Floyd to get ready.
Let's talk a bit about that, because we've talked a lot over the last several weeks about the facilities, the modular intensive care unit that we call B20 that's in our parking lot, the conversion of the first floor of the parking deck that's on our main campus. We've talked a lot about why we did that and logistics that have surrounded it. But those are topics that there's been a lot of chatter about on social media. And if it's okay, I'd like to I think the best way to do is just read these to you and have you respond if that's okay. One of the comments that we've seen is, I wonder if the government is being fleeced by Floyd Medical, and then it goes into some numbers, 41 hospitalizations total, which hospitalizations, yes, but not just 41 positives. But a mobile pod, converting the first floor of the parking deck, what was done in our northeast wing, what am I missing here? And then there were other similar comments about, is there government money involved, and what's going on at Floyd that they're not telling us? Could you address that?
Yeah, I'm happy to. Excuse me. As I said earlier, and as you began, we want to be open, transparent, and answer people's questions. If somebody thinks there's something there going on with the funds, well, there's no there. And I hope that I can provide some insight into that. I was just looking back on my calendar, reminding myself when this all started for us. And actually, our first patient came here on February the 29th, which was a Saturday, and we didn't know it. We didn't know she had COVID-19. And it was only when she came back again on the following Tuesday, and we admitted her. Again, we didn't have any testing at that point. The only thing we had was what the public health was supplying to us, is ask the travel question. Have you been to China? Have you been to Italy? And it was no, and a couple other places no for her. They said, well, okay, she's all right. And our clinician said, no, we think she's showing signs and symptoms of what we're reading about. And so we think we should admit her and treat her as if she has it. And they were right. And the public health guidance we had at the time would have told us to let her go, or actually what would have happened is that we would have admitted her into our general population, because she needed hospitalization because she was very much in respiratory distress and she needed our care. But she would have been in our general hospital population, and who knows how many folks would have gotten infected. So, our very expert clinicians were up to date, and they gave us the proper guidance. And you got to think back to early March. what was going on in the world. And I think so much has happened since then, people tend to forget. But back in early March, we had it raging in Wuhan, China. When I say it, I mean COVID-19. And it was beginning to rage through northern Italy. And in northern Italy, they were running out of hospital beds. They were taking care of patients in the hallways. They were running out of the ability to isolate. They were running out of ventilators, having to choose who would get a ventilator and who wouldn't get a ventilator. Very, very frightening circumstances. And people were predicting that here in the United States that we were going to have that kind of set of circumstances here in the United States. And it started in New York City. And New York City got overwhelmed, and they built out the Javits Convention Center in order to take patient overflow. They did the same thing in Chicago and built out the McCormick Convention Center in order to take care of patient overflow. There was an article in the Wall Street Journal today about how they prepared at the University of California, I think it was Santa Barbara, no, it wasn't Santa Barbara, but University of California in the New York Bay Area, the San Francisco Bay Area, and how they prepared as well. Now we know how all of that played out as you remember it. They actually overbuilt and didn't need as much as they thought they would need. But while all that was occurring is when all of the controls started to be putting on about social distancing and closing down places of gathering. Well, as all that was occurring and the dire predictions were out there, our planning team, as we were taking care of patients, said, well, what do these numbers mean for us as we start translating them into the 350,000 people that we take care of? What does that mean for us? And we started looking at those projections, and we were running out of beds too, as the projection showed. We wouldn't have enough beds, we might not have enough ventilators, and we take our responsibility to be here and be ready for our community very seriously. And so, faced with the data and the scenarios that we had at the time, we responded just like New York City did, just like the city of Chicago did. We said we have got to build out some temporary facilities. And so we began. We began converting patients in the hospital, patient rooms in the hospitals in order to have negative pressure capability. And for those who are listening don't know what negative pressure is, it means the air doesn't recirculate, the air gets vented to the outside. So there's no recirculation of the air around a patient as they are infectious. It won't get out to the caregivers, it won't get out to the general population. So we focused intently on that. In fact, we converted a whole wing here in the hospital in order to take care of and focus our intensive care capabilities for the COVID-19 patients. But then that really wasn't enough according to our projections. And so we said, well, we really need to think about where are we going to take care of all these patients? One of the ideas was, well, let's go across to the Forum here in Rome and see if we can build out the floor there, on the floor. And as we looked at that, we thought, well, gee, that's going to be a mile or more away by road. We have to get all of our supplies and personnel and everything else. And then the idea came up out of our work group, well, why not convert the lower level of our parking garage, which is what we did. And we stood that up in 3 weeks. It's truly an amazing display of teamwork, and it's still sitting there and ready in case this ever happens. Now, I know one of the questions or post that was put on social media has been critical of us because here we've spent all this money and we've built this facility, including the pod out in the parking lot that GEMA supplied, and we're not using it. Well, I call that good. Yeah. It's good. It means that all of the things that we've been doing in terms of encouraging people not to gather together in large groups and to close down bars and restaurants and places of worship and school and everything else, it's worked. But I'll say it's worked so far. As we start loosening things up and people getting out and about and circulating, a lot of folks are predicting there might be a second wave. Again, I want to remind everybody that is listening that we planned all this back when things were raging in Italy and the predictions for New York and the rest of the nation were not very good. The good news is that we'll be ready if there is a second or a third wave. I just was looking up some statistics in anticipation of this afternoon, and here's one that's kind of daunting. And it said, this came out of the University of Washington. They said among those who show symptoms of COVID-19, there's a 1.3% death rate. and it's 0.01 for the seasonal flu. And we know that COVID-19 is about 3+ times more infectious than the seasonal flu. They said if the same number of folks get COVID-19 in the United States who got the flu last year, that's 35.5 million people. If 35.5 million people get COVID-19, that means 500,000 U.S. deaths. I mean, that's pretty astounding.
Yeah.
Right now we're at 90,000. Does that mean we've got more than 5 times more to come? Man, I hope not. But we need to be ready in case it happens. And so when folks look out here in our parking lot and see these facilities, I hope they'll take confidence in the fact that their community hospital has planned and is ready. And I hope they stay empty. But we're ready if they don't.
So how about this idea? Because this has been a similar kind of question that we've seen here and there, but this idea that there's some kind of funding, or there's we're doing it for the money. A comment was made that it costs Floyd X amount of dollars to do these things, and they receive 3 times X in exchange for doing it.
Well, I wish there were a lot of money in this, but actually there's a lot of red ink in this. We hope that some of the costs that we've incurred get reimbursed. We built the lower level of the parking deck to house our field hospital that can take care of 100 patients and surge to almost 200. Haven't used it yet, but it's there and it's ready. There's not any that we know yet direct reimbursement for those costs. We're hopeful that what we call B20, it just stands for 20 beds for us, we called it B20. That's what others have called the pod that's sitting out in our parking lot. We hope that we will get some state funding for that, and we've been told that we might indeed get some state funding. We're not exactly sure how much those are costing because we stood them up because we thought we needed them. I'm guessing it's going to be $1 million or more is what it cost us when you come right down to it. We'll see, because we're still calculating and capturing all those costs. And we didn't do it in order to get some special source of funding that would give us a greater return, because that's just not the way we approached it and not the way that this works. We have gotten some federal funding, but so have other hospitals in the nation, and it's been in relation to the stimulus funds that have come down from the federal government, and all of that is an open book. I mean, anybody wants to know those numbers, they're available. The government publishes them. We can give them. We got some in order to stabilize our organization. I mean, let me just give some numbers as to what happened to us in the month of March and April. On a normal ongoing basis, a normal month for us would be about $40 million in net revenues. And we've had a good year this year up to February, although not anymore. But up to February, we were running about a 4% operating margin. So that means 4% of 40 million, we were taking about $1.6 million to our bottom line. And so our expenses were about $38.4 million if you do the math. So 40 million minus 38.4 was $1.6 million, which is what we should be doing. I mean, that's a good, healthy operations for a not-for-profit hospital. And so once March and April have happened, our revenues have dropped. For the month of March, they dropped to 30 million. Well, the expenses are still up there at $38 to $39 million. So there's almost a $9 million loss the month of March. The month of April, our revenues dropped to 24 million. Expenses are still up to $38, $39 million. So we're down about 16 million there. Well, the federal government has recognized that this is going on in hospitals all over the nation, and they said, well, we've got to help stabilize these very essential providers, because we've got to pay the payroll. We need all these doctors and nurses in order to take care of everything. We got to pay for our supplies. And so in the first stimulus bill, there was a lot of funding for hospitals, and we got some of that. Now, it didn't wipe out the losses by any stretch of the imagination, but it has helped to stabilize us to some extent. Not at all related to the build out of what's in the parking lot or the parking deck. It came out of the stimulus funds, and we project that we're going to be in a loss position probably until maybe August, September. We hope we're going to start climbing out. So what caused the losses? Well, we stopped doing elective surgeries. Our emergency room volumes were sliced in half because people were afraid to come to the hospital. Our urgent care volumes were about sliced in half for the same reason. Our regular medicine volumes of people that were admitted were way down as well. People were thinking, well, gee, I've got to shelter, I got to stay at home, I don't need to go to the hospital, I might get sick, I might catch it at the hospital. Well, that's a terrible fallacy, and we hope people start getting out of that, because delaying care can have very negative health outcomes for people. If you think you have a heart attack and you don't seek care, well, that's an awful decision. People really need to seek care, when they're feeling signs and symptoms. But that's part of the financial picture we've dealt with. So for anybody to think, well, gee, Floyd is taking advantage of some kind of government programs here, that's just not the case at all.
Well, I appreciate your honesty about that. And I've heard you say early on that the best case scenario would be that we lose money on these facilities, because that means that we never have to put anybody in there, or the best case scenario would be that we never have to use them, and we still hope that's the case. Regardless of the financial side of it, we're hopeful that they never get used. But it's a situation. I think when I think about yourself and I think about our leaders and the decisions that have to be made, I understand that in some ways it's a no-win. That if you don't do it and you need it, that's far worse than doing it and not needing it.
Well, absolutely right. I mean, if the sheltering in place and not going out to public gatherings and the other things that our communities seem to have done so well, if those hadn't worked, and we said, well, we're not going to build out these facilities, we would have been in just a mess. I mean, we would have been overwhelmed with patients, not been able to care for them. It might have been what went on in northern Italy, and what's also beginning to happen in Brazil and Mexico City. I mean, the coronavirus is still out there. I mean, we've got to stay vigilant, and I hope all the things that we have put in place in terms of our new social practices continue to be effective. But we're ready in case there is a rebound. In fact, the Governor Brian Kemp was here last week visiting, and he wanted to see what we call B20, our 20-bed unit that's been provided to us by GEMA, the Georgia Emergency Management Agency. GEMA, with the governor's direction, decided to locate these throughout the state of Georgia. I mean, they helped build out some capability in Albany. They did it, of course, here in Rome, also in Macon, in Gainesville. They built out a field hospital capability in the Georgia World Congress Center. This approach by the governor in the state of Georgia was to have these resources all distributed just in case. And he said, this is wonderful. I hope we never use it. So he said the exact same thing.
Yeah. Kurt, you mentioned the year we were having, and you talked about January, February. We should mention that our fiscal year runs July 1 through June 30th. So we were well into our fiscal year by the time this occurred. And I think I kind of preface what I'm about to say with that, because I think the community has a lot to be thankful for about how we conduct business at Floyd, because we were able to weather this much better than a lot of hospitals have been able to. And maybe you speak to that just for a moment.
Well, that's very true. I mean, we've got a good operation here at Floyd. We've been working for many years in involving all layers of the organization in process improvement. We practice what's often used in many industries called Lean and Six Sigma, and we have deployed that throughout our organization with all of our work teams. We also use a variation of the General Electric 100-day workout model, where we're constantly working on things in teams, and these have resulted in thousands of changes and millions of dollars in improvement. We've actually been doing this for 13 years, and for our fiscal year up through February, before COVID-19 hit, we were running, as I said earlier, about a 4% margin. And that's a remarkable achievement for hospitals such as Floyd Medical Center as a safety net, community-based hospital. We were performing better than many in our class of comparable hospitals. There are a lot of hospitals out there in the United States that aren't performing well, and a lot of hospitals that will be seriously struggling throughout the rest of the COVID-19 experience. I mean, it's rough on Floyd right now. I don't want to mislead anybody, but we were in such a shape that we had what's called 210 days cash on hand, which means we had enough money saved and set aside for emergencies. It was a rainy day fund, and that number tallied about $250 million. What it means is that we had that banked in case we needed to use any of it, and by gosh, we're having to use some of it. And it's put us in good shape, and we haven't had to do any of the furloughs or layoffs or things that other organizations in other industries have had to do, because we could rely upon the financial strength that we have worked so hard to achieve through the years. So it is good news for our community, and everybody in our organization, led by our board of directors and our executive team have done a really good job at this. That's not to say, things continue at their current level that we might have to do something. I hope not. I just saw an announcement this morning that the Wellstar Health System in Atlanta, I think they're about 11 or 12 hospitals strong, big hospital system. They're doing a furlough of over 1,000 employees, which represents 4% of their workforce. And then another 3% of their workforce is going to have to cut back on their hours. Now, I don't think their workload and the things that they have to do to be flexible and adjust to the current environment has necessarily gone down, just like it has in here, but their financial picture is such that, gee, we have to do something, and so that's what they're doing. And lots of hospitals are having to do that. And I don't rule that out as something that might happen at Floyd, but not yet. And our good financial performance through the years has enabled us to be financially strong and not have to do that at this point.
I'm glad you said that, because that's actually one of the other misconceptions we've seen pop up from time to time, is that there have been layoffs at Floyd, and that hasn't been the case. There have been some workers who have been shifted to help out in areas where we need it, but so far we've been able to keep everyone whole.
Yeah, we have. And we have, and I hope we can continue to do that. We need our volumes to come back. I mean, all businesses need that. The whole economy, every newspaper that you pick up, every news feed that you look at on your phone or your computer is talking about the state of the economy, and lots of industries are suffering. We could both name off a whole list of them where volumes are down. All industries, all businesses, need their volumes to come back, and we do too. But as it relates to hospitals, it's also related to people's health. People need to get the care that they need.
Yeah, absolutely, and you can be. We've said it every week for the last several weeks. You can trust us to keep you safe if you come to Floyd, whether it's for an outpatient service such as radiology or breast center or any of those types of services, primary and urgent care. We'll keep you safe when you come to Floyd. One of the other questions before we wrap up that we've seen from time to time, and this one is not just local. You see that this discussed nationally, is this idea that hospitals are diagnosing patients with COVID-19 because they're paid more for COVID-19 patients. We get reimbursed more for that, and has been said quite often. Could you address that one?
It's just a little bit more. Medicare has given a different code for COVID-19, but it's really insignificant. We're glad to get everything that we can get in terms of recognition that takes more resources to take care of a COVID-19 patient, because it does. We have to put them in special areas. We have to what we call don and doff, put on and take off personal protective equipment. That's very resource intense and expensive. So it costs more to take care of a COVID-19 patient, and Medicare's recognize that, and they give you a little bit more. And so as we've gone through COVID-19, okay, we're getting a little bit more for these types of patients, but we're not doing elective surgeries anymore. Our ED volumes have dropped in half. Our urgent care volumes have dropped. Our primary care offices, they're not seeing as many patients. There is absolutely no windfall. There is not any extra money that's coming in that can make up for all of the ground that we've lost.
Well, Kurt, I just want to say thanks for the transparency throughout this process. Just the willingness to go before the public like we've done every week, and kind of open ourselves up to these kinds of questions and to address them is very much appreciated. I didn't warn you about this, so I apologize up front for putting you on the spot. But at the end, we hold these town halls every week internally, where we do a similar kind of thing with our employees and give them a chance to ask questions. And I always wrap those up by asking if you have any final words. Well, with this being, possibly the last of these Facebook Live editions we do for the foreseeable future, anything anything you'd like to say about whether it's about the work we're doing at Floyd or the community or anything else?
Well, there's a lot to say, and we'll do more of these if we need to, but we think we're at the point where perhaps we don't need to do these on a weekly basis anymore. We did want to have this one to respond to some of the things that we've seen on social media, and you mentioned our town halls. We've done, you helped me conduct them. We've done like 14 of these, and we started out in the COVID-19 crisis doing them face to face. And sometimes we'd have 70, 80 people, sometimes we've had 2. Yeah. And then we started doing them in a virtual format for all the obvious reasons, for social distancing. And now they're in the thousands every time we do them. And every time we do a town hall, I mean, any question is fair game, as long as it's not personally insulting to somebody and inappropriate. So we continue to have these town halls in the same manner and fashion. And likewise in responding to things that have been posted on Facebook. I mean, sometimes people are very fervent and very wrong, and that's one of the reasons that we want to get our message out there, so that transparency is certainly important to us. That it's in the good book that the truth will set you free, and I firmly believe that. We've got nothing here that's going on that's untoward. We've got very dedicated men and women on our governing board and our leadership. And all the heroes behind the mask who have done a remarkable job taking care of folks. That part of what we've been through ever since February 29th is just absolutely amazing. To see people pitch in and use their brains and work with one another as teammates to get to the best answer, not only in the treatment of the individual patient, but the right policies and procedures, and how do we need to deal with this and how do we deal with that. It's been an amazing experience to work with all of our folks. I wish our community could see some of that and have the same sense of pride that I do in our organization. Our organization's tremendous.
Yeah, absolutely. Kurt, thank you. Thank you, as always. We appreciate it. And thank you for joining us each week on these Facebook Live sessions. We've been honored and happy to spend this time with you each week and provide an update on how things are going here at Floyd. Again, this will be the last one that we have scheduled. If things were to change, or if we feel like it's necessary to come before you with a message of what's happening here at Floyd, we'll let you know on social media. So make sure you follow Floyd on Facebook and Twitter and Instagram for that information should we decide to do another one in the future. And who knows, maybe somewhere down the road there's a topic even beyond COVID-19 that we feel like is important enough to schedule one of these as well. So be sure to follow us on social media for any update along those lines. And also check out floyd.org/COVID-19. That's where you'll find daily updated information on what's happening here at Floyd. For instance, at some point in the near future, we're going to be updating our visitor policy and our parking situation and things like that. And that information will be available to you not only on Floyd's social media, but also floyd.org/COVID-19. It's a great resource for you. Thanks so much for joining us today. And until we talk to you again, we just encourage you to be safe and have a great rest of the week. Thanks.